Everyone has an addiction to something, whether that be using substances, not shopping too much. It all stems from that lack of feeling great.
Addiction is nothing new in Angie Guerin's life. Growing up, she says it seemed like everyone around her was abusing some substance, but she never imagined following doctors' orders would put her on the same path.
I was completely and totally addicted. I had no clue.
This isn't something that's just for those people that you think have drug addiction problems. It's actually can be a daily occurrence that your neighbor on the street who looks sweet and friendly can actually have an opioid problem.
Teresa Stickler fills prescriptions nearly every day and says the potential for one of her customers to be abusing does cross her mind.
How do I decide which patients am I going to keep and not keep? Which ones really have pain or which don't? I assume the doctor knows which patients really have the pain.
The best way to crack down on these excessive sales is to have doctors check to see if the patient they're giving a prescription to has gotten prescriptions from other physicians. And that's what the monitoring system is all about.
This year, the state legislature implemented a mandatory prescription drug monitoring program and facilitated access to the opiate deterrent naloxone.
Injection complete.
The two programs together provide a way to tackle the problem on two fronts. One decreases the possibility of an excess of pills on the street. The second provides an emergency help to those at risk of overdose, and both do it without overstepping doctor-patient relations.
I think we've gone pretty far, so we're going to ease our way into the ones that may not require, a full 50 caliber attack.
The legislative efforts have kept Arizona in the fight against the opioid epidemic, according to the National Association for Model State Drug Laws. Between 2009 and 2014, the state's rank in number of overdose deaths dropped 9 places to 15th. But, according to the Arizona Department of Health Services, this may not signal improvement.
The overdose deaths are not actually decreasing. I think it's more of a matter of we're kind of holding our own compared to other states whose rates have significantly worsened.
In order to build an adequate foundation to tackle the opioid epidemic, the National Association for Model State Drug Laws suggests that states implement naloxone access, prescription drug monitoring programs, Good Samaritan laws, and adequate intervention programs. Arizona lacks Good Samaritan laws, and although intervention programs are being developed, advocates say it's just not enough.
We say that we care about people's lives, but we're pretty quick to lock them up as well.
Advocates say Good Samaritan laws save lives by building trust between drug users and law enforcement.
What we're trying to do is increase people calling for help. It's just like with a heart attack, the difference between survival and death is how soon you get help.
The legislation has been proposed in the state before, but opinions on how and if it should be implemented have blocked its passage. Still, one thing everyone agrees on is that the most important program to push forward is one that educates the public on drug abuse and helps Arizonans understand everyone plays a role in the problem and solution.
I think the biggest negligence lies in society in general. We have created a society where we all deserve a quick fix, and we are all looking for something to make it easier.